over to Patricia. Thank you very much.
Thank you. What do I do with So hi everybody, I'm Patricia Manson, and I've been doing aesthetics since 2009. I started in my dental practice then, and have been continuing along with my journey for the last 16 years. I nearly wasn't here today. I now know how to fast track yourself in A&E, by the way. You semi-amputate your thumb and go in with an open fracture, which I did a few weeks ago. But the upside of that is, well, the downside is I can't work at the moment. Thankfully, it's my left thumb. But the upside is the sunshine has been wonderful and I've just been enjoying it. So, yeah, so I started my aesthetic journey 16 years ago. So when I was a dentist, I spent 27 years as a dentist, and I very much am the sort of person who I'm very tactile, and I like to develop my own ways of doing things. And over the 27 years I was a dentist, new products came on the market. The next greatest thing came on the market. I would try them and decide whether they were going to be, suitable for what I did, for me, for my patients. And I've probably transferred these skills onto the aesthetics. So my aesthetics journey is the same. I take what works for me and then I continue with that. If it doesn't work, I take it by the collar and the pants and it goes out the door. And, there are products which we all have tried and we think, oh, this is meant to be the next greatest thing. You don't get the results. Your patients don't see a difference. Then you think, right, I'm not going to continue with it. Because we in this industry aren't salespeople, we're clinicians, and results are what gets our patients buying from us. We don't sell, we use our results to speak for us. So we've got to get results. My practice is very much results driven. And the other thing I've developed over the last 16 years is an ability to be able to help my patients long term with their skin, and especially with rosacea, acne to a degree. Rosacea to a degree as well, but I'll explain that in a minute. But with taking a long-term approach, so it's about not giving people courses of antibiotics, which just cause a leaky gut, as Julie's been explaining. It's about trying to help them long-term, help themselves. And there's lots of different strategies you can give your patients. And that's what I really do, is get them on the long term, take them on that journey with me. And you'll see from some of the results I have, some results you can get in 3 weeks, some results it takes a year and a half, 2 years, some you never get the results you really would want for the patient. It's just about managing the rosacea. So I'll go into all that for you. So the aim of the talk is to help you recognise how it manifests in your clinic from one patient to another. You might think this is like teaching my granny to suck eggs, but actually I thought I knew a lot about skin for the first 10 years in clinic. And then 2 things happened. I went on a journey, met Claire in 2018, started doing the WOW. I was the first person in Scotland to roll out the WOW facial. And Claire then introduced me to Pam Cushing in a very drunken weekend in Dublin. Just as the world was closing down. I mean, Glasgow Airport was totally empty at this point. And yeah, and I met Pam Cushing, who is she owns PH Formula UK. There isn't anything about skin Pam doesn't know. She's just an absolute mine of information. And she took my knowledge to completely the next level. And I actually rolled out her skincare brand, PH Formula, during that first lockdown, believe it or not, with Pam's guidance. And I learned so much about the skin that I hadn't picked up on ZO courses and all sorts of courses over these first 10 years. So I really realised that there's a lot more to it than I ever knew, and I picked up on treating subtle rosaceas, ones that you didn't even know were there and you weren't recognising. So yeah, it took my knowledge to the next level. So by the end of the talk, I want you to feel more confident at recognising it in its subtle forms, as I was just saying, helping you manage patient expectations. It's, we all know what it's like treating our patients out there. It's psychology more than anything. And then give you some of my top tips and tricks that I've developed over the last 16 years on my journey. And I'm still learning. As you know, every day's a school day in this industry. So we've talked about rosacea already this morning, but rosacea is inflammation, and it ties in with what Claire and Julia has already said this morning. It's inflammation, it's redness, it's heat, it's inflammation. And it's really telling you that this person, that their skin isn't working very well. It means that their skin barrier is impaired. And you can use all the fancy skincare and products and treatments in the world, but if you can't get that barrier repaired first, you're going to get nowhere. You'll just keep going round and round in circles with patients, and that's what causes a lot of them to fall off the wagon with skincare. So rosacea will present in your clinic in various different ways. There are 6 of them on this slide. The first one is my patient Lauren. Very subtle, slight redness, with or without breakout. She had a few around this area here. Okay, I'll show you some of these ones at the end. The next one is Billy. This is a chap who I took on in that first lockdown, and Pam Cushing, she guided me through how to treat his skin. Now, because he was in his late 50s, it took longer. Lauren, it took 3 weeks to get her, really, her skin, you could see it in that 3 weeks, the difference. 7 months before we repaired Billy's skin barrier, and I'll show you how you know it's repaired later. Billy had moderate redness with breakouts, the papulopustular type, okay? Then we have Gary. Gary was he was like a beacon. He was so red. It doesn't actually come through in that slide, but he was so red. Gary had always had rosacea, but the problem he had is that he was working a month at a time in Azerbaijan in a gold mine high up a mountain. So he was getting wind blasted, he was getting sun blasted, he was getting snow blasted. It was such extreme conditions, and his face was so dry and so red. And he tried everything. In the testimonial he wrote for us, it was like, I've been to dermatologists, I've tried every lotion and potion under the sun. But you'll see his picture shortly. And then the next one is redness. This one here, has this got a wee pointer that I can use? Oh, there we go, there we are. So this one here is Denny. Denny in her 50s, redness in some areas only. So she had the classic kind of a wee bit redness around here, a wee bit redness on her forehead, and chin breakouts as well. Now this one here is a really important slide, because if you're not good at spotting rosacea, subtle rosaceas, I thought I was until I met Pam Cushing, but this is the telltale sign. If you're not sure, if you've got somebody in the chair for the first time and they're getting breakouts, they're getting acne, this is the telltale sign. The redness here around the alar region of the nose. That is what I use to tell me, is this rosacea or is it acne at all? And that is absolutely crucial if you're going to be successfully treating people's skin. Yeah. Yeah. Okay. It's that little telltale. You'll find that pretty much everybody who's got a very subtle rosacea even will have that. This one here, generalised acne. This girl here, Emma, she has a hairdressing salon in Stirling. I meant to say I actually work in Stirling as well as Julia. I have a small clinic there. And Emma has a hairdressing salon in Stirling. And she had, again, like Gary, she had been to everybody under the sun, dermatologists, umpteen courses of antibiotics, lots of acne scarring. And someday she knew, one of her customers had told her to come and see me. And she came in and I immediately looked at her, and what did I spot? The redness around her nose. And again, it doesn't come over in the slide, but her face was so inflamed. It was just screaming inflammation at me. So I treated her for rosacea and not acne. This was a picture she put on her Instagram. She put her whole journey with me on Instagram for everybody to see, and we completely cleared up her skin quite quickly as well, but she was in her early 30s, quite young, and yeah, we managed to completely clear her skin up, and she was absolutely delighted because she had been spending so much time struggling with her skin, and it was because I chose to treat her as rosacea and not acne. And then this one, Paul. This is the one to beware of. Beware of the flushing rosacea patient. Under promise. And you'll never over-deliver either. I'm sorry, but you just won't. It's a nightmare to treat. You'll never treat it. Well, you'll treat it, but you'll never cure it. You'll never get rid of it. You'll never get the skin completely stable. And that's because it's driven by the nervous system. The art of treating these people is spotting it the minute they walk in the door on the first visit. But it will be obvious to you because they'll walk in the door and what will you see? That redness going up their neck. That's your telltale sign that you've got a flushing rosacea on your hands. But also they will be so red. They'll just be really flushed. And you'll see that redness because it's the first time seeing somebody new. They'll be a bit nervous, so they'll have it. But when you take your initial photographs, spot it. On their neck or when you're talking to them because it really affects your management and also it affects your ability to tell the patients about to manage their expectations. You have to keep their expectations low. You're only going to help them manage it through their life. But again, you can help them with their stress levels as well in various ways, as Julia mentioned earlier. This is another type of rosacea. This is Samantha. Samantha, again, history of her entire lifetime, just constantly, struggling with acne, breakouts. She never managed it very well by her own admission, but she had this 25-year reunion coming up, was desperate to look better for it, for seeing her friends from the army, actually. And it's like she came to us and said, I've got this reunion next year. And I thought, thank God, it gives me 12 months to at least try and make some kind of impact on this. And you can see we did. Took the whole year. But phimosis rosacea, what is it? It's the thickening of the epithelium. It's the layers and layers of the cells. The epithelium becoming really, really thick and bulbous, and it's just because of all the damage it's had over the years, and it's very bumpy. It's thick and bumpy. You'll usually see it in men. You'll usually see it on noses. That's where you'll spot it first. You'll see it starting on noses. It starts with looking like the pores are really big, and then it'll become really, really thickened over the years. Sometimes you'll see an old guy who's got a really huge nose, and it's just because it's been exposed. He's maybe worked outside, maybe played a lot of golf, maybe been walking his dog for years and years and years, and,
It's such a shame, isn't it? Because you associate it with drink.
Yeah, drink as well, though. But people do think it is drink. Yeah. So, but this one was really over this whole entire part of her face. This one, the management of this, we targeted the redness first. Why? Because it was telling me her skin barrier was impaired. So it was about, let's fix the skin barrier first, because we're going to get nowhere if we don't do that. We're going to keep going around in circles. Luckily, when she came in for her first treatment, she didn't have any breakouts. So we thought, right, let's just go straight for the WOW. This was pre-COVID that I did Samantha. And we just went straight for the WOW with the Botox. And oh my goodness, by the time she came back a month later, what a difference the Botox had made to the contraction of the blood vessels. It was much less florid, calmed down. The oiliness was a bit more under control as well. So we really did manage to make an impact with the WOW first. And then we did a few more WOWs without the Botox a month apart. And then I did IPL to take away all the broken veins, which you can't really see very well on the slides. And then that was her ready for the reunion. It was fine, it was enough. But then we carried on smoothing. We then got her on the retinols. We then got her smoothing the skin with peels and, various treatments. But we targeted the redness first but the one thing about this slide and all the slides you'll see today are that Samantha's got that classic redness first. That their face is pink and red and inflamed. And then the way you know the barrier is finally repaired is that you get this lovely fleshy colour. So in my photographs, you'll think it's different lighting, but it's not. It's the barrier repair is because you get that lovely healthy fleshy colour, which she's got in the second picture. And it also makes them look younger as well, once they get that. So you gradually get this change. Now this can take anything from about a month to 2 years to get this lovely fleshy colour. And unfortunately, you can't really predict who it's going to take 2 years with either. So that's a different type of rosaceas. A wee note at the bottom there, just to say, if you've got somebody who's got that kind of very flushing rosacea, that real florid look on their cheeks, always keep it at the back of your mind. It could be something like lupus, especially, so this is where your medical history is really important. Just taking, an idea of how they're feeling within themselves. So always just keep that at the back of your mind. And the other one that I haven't mentioned, the other type of rosacea, is ocular rosacea. Ocular rosacea is really just affecting the eyes, but you usually get the wee telltale sign of the redness around the nose, and that might be your only other sign that this itching, this constant irritation around the eyes is actually rosacea. Okay, so just bear that one in mind as well. Yeah, it often has been by the GP as well, but even for us, it's hard to diagnose it as well, but you could just try, like Dermalux light therapy. We usually do it if somebody's got a bit of eye disruption. Because it's on the near infrared, we'll just keep the goggles off and keep their eyes closed, and then, give them the treatment on their eyes, give them some of the lotions and potions as well. When I first went on, I was doing ZO in the practice for years, and I don't know if any of you have trained on ZO, but my God, it can be so dry and boring when you're on the ZO training. I think I did it 4 times before I finally actually stayed awake the entire time to get the full training. And they tell you, ad nauseam. It's like, take the history, find out this, that, and the other. And you go, yeah, but it is so important. You've got to get this right at the consultation. I can't emphasise that enough, because it's going to affect how you then go about treating this person. So the things that you've got to ask them, what are triggering this? What are the triggers for you? And find out why, maybe try and figure it out, be a bit of a detective, find out what's going on here, what's causing this rosacea. There often is a genetic factor, which I haven't put on that slide, but there's different categories here. So the first 3 here are hot flushes, aerobic exercise, hot baths. These are all creating a lot of heat within the skin. The hot flushes, people usually know why they've got the rosacea, because of perimenopausal or postmenopausal. The aerobic exercises, this one can really fly under the radar. So if you've got a patient who's a gym bunny and goes to the gym maybe a couple of times a day, or is a personal trainer, or goes running a lot, Billy, the guy with the very red nose that I showed you earlier, he was a runner. This could be creating quite a lot of heat within the skin, so the skin's never getting a chance to recover. If they're working out every day, they're creating a lot of heat, a lot of oil, a lot of sebum, sweat. Their skin's never getting a chance to repair. And just that question can give you an indication of why that person might be struggling with rosacea. Hot baths, somebody maybe has a hot bath every night. It could be driving this rosacea. I have rosacea as well, like most people in Scotland, and it's my nose that's the thing that really flushes. And I can be sitting at night quite happily, I'll have a wee blanket over me, I'll have my cat on my knee, I'll be sitting watching the telly, next minute I'm like, whoosh, the flushing starts. And trying to get it to calm down can be a nightmare, but if I'm doing that every single night, it's going to keep driving that capillaries getting engorged and keep driving the rosacea. The next one is diet. Julia has touched on that. So we've got your spicy foods, dairy products, alcohol. Spicy foods, it can be pretty obvious that that's what the cause of it is. People will usually be aware of that. We send people for intolerance testing. It's a big thing in our clinic, the dietary side of it, the gut health as well. And we find that it's the nightshade group of food that causes a lot of the triggers. So it's not just the spice, it's things that might be in spicy foods like tomatoes, tomato-based sauces. The nightshade group of foods are red and purple. So tomatoes, peppers, chilies, aubergines, all the things that are red and purple basically, and they can really trigger rosacea as well. So that it's worth getting some intolerance testing done to find out if there are triggers. Dairy products is another biggie, but watch this one, because you might ask somebody, do you have a lot of dairy in your diet? No, I don't have that much dairy at all. I don't drink tea or coffee. No, I don't have much dairy at all. Do you like cheese? Oh gosh, I love my cheese. I love my cheese. And that happens so often. Ask them about their cheese after dairy, because apparently cheese isn't dairy. So, but that one can really fly under the radar. You can get cow's milk intolerance, lactose intolerance. They're two different things, but the dairy is a big one as well. So what I say to people is, even before they go for the intolerance testing, if you suspect yourself, because people often do, they suspect it, cut it out for a month and then let your skin recover, see what happens with your skin, and then start to very gradually, very slowly reintroduce it, and you'll notice where your tolerance level is, because you will have a tolerance level, but you'll know if that thing is the trigger. And if that's not the trigger, the next one usually is alcohol. That one can really fly under the radar as well. I've realised this over many years, how honest people are at the start, to then 6 months down the line when you're not getting anywhere, it's like, oh, I've got a really bad flare-up today. I just can't get to the bottom of this. I don't know what's causing this. Well, what do you think could have caused the flare-up? What were you doing at the weekend? Oh, I was out with friends, we're at a barbecue, or I had far too much to drink, spent the whole of yesterday recovering. Well, and now you've got a big flare-up. There's your answer. And that one can really fly under the radar. So that could be one that is really worth chatting to about. Sometimes you're not really going to get the honest answer at the start. It's as the subsequent appointments happen that you might get to the bottom of that one. You've got two different types of drinkers. You've got the bingers who are going out the weekend, getting off their face, spending Sunday in bed, possibly Monday as well, or the holiday bingers. You've got the other type who are the slow and gradual, come back from work, stressful day, pour a glass of wine, then pour another. And that one, again, both can have the impact, the slow and kind of constant impact of breakouts. Sorry? Yeah, you are right, actually. There's the third one. Definitely. So, and then you've got the other group is the weather. Heat, wind, exposure to sunlight, cold, a bit like Gary, who works up the gold mine in Azerbaijan. And he was getting basically sandblasted up that mountain and sunblasted as well. We'll talk about that in a wee minute about the dog walkers, another one to really watch. And then the bottom one here, stress, can massively impact the skin. The amount of times over the years I've seen people come in and they've not just got breakouts, they've got huge cystic breakouts, and somebody has just died, or they've recently split up from a relationship, long-term relationship. It has a massive impact. It's not just the stress, it's usually their skin type, there's usually oil lurking about as well that's causing these problems, but it's a massive one. And yeah, you can get them doing all the mindfulness stuff, the hypnotherapy, but yeah, it's a bit of a minefield, that one. Again, just helping them manage it is the best way. So being a detective, asking about these things at the outset. Look for the telltale signs around the nose. If you're not sure, take a photograph and have a look at the photo, because sometimes it's easier that way. Ask them about exercise, especially men working outdoors, but dog walkers, that's another one that can fly under the radar. Are you outside much? No. Do you go hill walking? Yeah, go hill walking. Do you, but you're asking them, are they outdoors much? No. Do you go hill walking at the weekend? Oh yeah. It's like, so if you're going hill walking, you're out for what, 4 hours? Or you're not out much? No. Do you have a dog? Yeah. Who walks the dog? Me. Right. How many times do you walk the dog a day? A couple of times. So, okay, so you're going out for at least half an hour twice a day and getting all the, the weather exposure. So these things, you've got to really dig a little bit to get the right answers and to help your treatment plan. The I've mentioned that one. Look for the oil. I'll show you a picture later. You get really good at spotting oil. You can get to the point where you can spot it 100 yards. And there are wee signs, apart from that kind of just general stickiness that they have to their skin. Look for little telltale signs. Milia, the little hardened whiteheads. Big milia, which are sebaceous hyperplasia. Sebaceous hyperplasia, we've spotted in our clinic. If somebody comes in and they're covered in them, there is a chance that they have got massive stress as well. That's just me and what we've spotted in our clinic, but they're the ones that you gotta be very careful about what you can promise for these people, because if somebody's covered in a lot of the wee bumps, there's usually a lot of stress and trauma has gone on in the background. It's just what we find in our clinic, but it's a sign for us. This one here, again, somebody might be working in a kitchen. We've got a woman who has a pizza van, and trying to keep her rosacea under control is a nightmare because she's working in this really confined hot space with this hot oven. So again, ask what they do for a job, especially with men, they're often working outside. Medical history, again, they might have issues with their gut, and then you think, well, there's probably a gut issue going on there as well, which isn't helping everything. So managing your patient's expectations. This is the start of me giving you the tips. Pam Cushing, when I met Pam in Dublin, Pam taught me that 60% of acne patients it's actually rosacea. It's not acne. And if people are adult, usually beyond their mid-20s, it's rosacea. It's probably not acne. So I always start off assuming it's rosacea and then work backwards from there if I've got an adult, in the chair for the first time. The second one, be realistic about your results with rosacea. I still can't predict who I'm going to get a cracking result with because there are so many factors. There's so many factors with all the things we've just talked about, all the triggers, but you've also got patient compliance, as we all know. You'll get some people who are fickle, some people who are really diligent, and it can be a nightmare. So always be very cagey about promising what can, be the outcome for them. And then this leads on to be realistic about how long it might take. Warn them that it is going to take time and consistency. It's like going to the gym every day with their skin. What they're doing at home is like going to the gym, and we're like their personal trainer. And we're here to give them support and also to give them a kick up the backside when they need it as well. But be realistic about how long it might take. Don't give an answer to that question because you're just setting yourself up for failure. If they've got some event in a year that they're getting ready for, that's great. That gives you time to get an improvement if you think you might manage to get an improvement for them. If they say, I've got a wedding in 2 months or something, and they come in and we've got quite a severe problem, you're only ever going to help, manage that to a certain extent. You've not got enough time to really repair the skin barrier. This is another one. Keep it simple at the outset. Don't give them a whole load of products, send them away and think, right, that's their problem's all going to be solved. Keep it really simple. Build their trust. Because if you give them good medical grade products and they use them, they are going to start seeing a difference fairly quickly to their skin. They might not see a big difference in the redness, but they'll see changes, and they will. But if you pile in the retinol, go for a really complicated plan at the very outset, then if they can't cope with it, or they start to get flaking and redness from retinol and they're struggling to cope with all of that, they'll just think, just another load of products that don't work. They won't even come back, and off they go, and you've lost their trust, you've lost their confidence. And they'll just, go away and try something else. So build up their confidence very gently and gradually. I don't apply any type of retinols and with skincare until the skin barrier is fixed, is repaired. Till I see that nice fleshy colour, I just don't do it, because I think more times than not it trips you up, trips them up, trips you up, and you end up getting nowhere with it. You go around in circles. That's just my opinion. So, yeah, everybody's different, but I wouldn't put the retinols on too quickly. And then the fifth one, a wee trick, is spot that flush and rosacea the minute they walk in the door, because that's going to affect your treatment plan. It's going to affect their expectations and the outcomes. Okay. And this one here, if there looks like there might be a gut problem or a lot of stress, then get some intolerance testing. We do the advanced nutrition that Julia mentioned. We've done it for about 10 years in our clinic, I think, and what a difference it makes. It power boosts the results that you can get for people, so it accelerates the results that you can get. That brings me on to this slide about the treatment of rosacea. So, yeah, you can do treatments, but don't underestimate the power of skincare alone. Sometimes like during COVID, if you sent a patient off and then they came back in and they've not had any treatments, what a difference the skincare can make just if they're working away diligently at home. What we do, one of the questions I ask people is, so we get around to the subject of skincare, and I'll say to them, okay, we're going to get using these medical grade products and explain what the difference is between the medical grade and the non-medical grade. And then I say to them, my next question is, if you go and buy a whole load of new skincare, are you good at sticking to it, or do you fall off the wagon pretty quickly? They will always give you an answer for one or the other. People are not in between. They're either really diligent and brilliant at sticking to a skincare routine, or they're flighty. And that then helps me decide on a treatment plan for them. Some people say, I'm rubbish at skincare, I'd rather come in for the treatments. That's fine, but they're still going to have to do a bit of the skincare at home. So you emphasise to them why it's so important, and you get them on a very simple routine, a very, very simple routine. And then you support that routine. And once you've got them on that routine, then you can build on it. Once you've got them into a habit, and once they're enjoying it, because people do enjoy improving their skin when they're seeing the results, then you can build on it. Then you can make it more, diverse about what you're giving them, but keep it simple at the start, and don't underestimate the power of the skincare alone. I've got many treatments and gadgets in my clinic, but I'll usually start them on the skincare and then I'll review them after 4 weeks. That 4 weeks is really important because it helps them get into a wee routine, and then we get them back for the review appointment. I can tell the minute they walk in the door if they're sticking to it or not. You get to the point, just know, you can tell, because their face is usually less florid for a start. There are less breakouts, and they just look a bit younger and healthier. If they walk in the door and there is no change, then that means you go back to your list of questions. Let's start, and I'll ask them. My little trick of finding out if they're sticking to the skincare that you've given them is, okay, let's talk about your skincare routine. What are you doing in the morning? So I've written it all down at the first appointment, what they have to do. What are you doing in the morning? And if they're using their skincare that you've given them, they'll go, yeah, I'm using that cleanser, and then I'm using the pads, and then I'm using the serum that you gave me, and then I'm putting my SPF on, and then at night I'm using this, and they'll tell you the names, and they know it inside out. If they're not sticking to it very well, they'll go, that thingy thing that you gave me, that, cream, they'll not have the routine of Pat. So therefore, then you go over it again, you write it down again, you give them the support again. The support you give them is going to make or break their success. Oh, sorry, didn't mean to do that. The support that you give them is what is going to basically determine the outcome. It's going to determine whether you can help them long term with their skin problem or not. It builds that relationship, and when you build a bond with your patient, they trust you more, they'll refer people to you more, and most importantly, they'll come back and buy their skincare from you and not some dodgy site of the internet. So you'll get the sales out of it. It's not why we do it, but it's important for the survival of your clinic and to give you an income. But that long-term compliance is so important. That bond is what's going to keep them as a loyal patient coming back. They've lacked that bond with somebody all their life to tell them how to look after their skin, because people don't just develop troublesome skin. They've usually had it all their lives, and they've lacked that bond. They've gone to GP, been doled out antibiotics, they've been referred to a dermatologist, they've been doled out antibiotics. So that bond is what's going to keep them keeping going and improving their skin over the years, and they'll become a really loyal patient, and they'll send you other people as well. So support equals long-term compliance, and it's so important. It's so worthwhile doing. I don't charge for review appointments because they're usually buying the skincare when they're in as well. And it's just one of the ways of, building that bond. If you spend time with people, our motto actually is time for you. If you spend time with people, then you actually will make more money because they'll spend more. It's just a fact. They'll just spend more because they want to give you the business. They feel loyal to you. They're interested in finding, okay, we've done this now. What about my neck? What about my eyes? What about back of my arms? So they'll spend more money with you if you spend time with them. And these little 15-minute appointments, just to review them, just to check in, is what's really going to help them. And it'll help them stay on the wagon, because when they start to find it tough and they're thinking, oh God, I'm falling off the wagon a wee bit, you can be there to bolster them, give them a wee kick at the backside if they need it. We in our clinic call it a hug with a slap. just a proverbial slap, but yeah, we call it a hug with a slap. Yeah, come in. I know things are tough at home. I know you've got an elderly parent. I know you've got a child with special needs, or you've got young children. But let's see. What about when you're in the bath? When they're in the bath at night and you're in the bathroom, why don't you do your skincare routine then, so that you're in the bathroom for 10 minutes, you can be doing your skin. Find ways of making it easier for them to do it, to fit it into their life, and they'll really thank you for that. Treatments accelerate the results of the skincare, because it's the skincare that's going to get you most of the results. That's what's going to get you the results, because it's also going to get you the long-term results, because if you've got them doing the skincare long-term, that's going to keep them on the straight and narrow with their skin. So, but treatments and the gut health side of it, the advanced nutrition that we give them, will accelerate, the power boost your results. So WOW Fusion, great place to start, as long as they've not got active breakouts. We tend to do more of the WOW facials. I just build it in as a plan, and then the patient pays monthly for it. And it spreads out the cost, because the WOW facial has got all these beautiful products that are going to help with the whole skin recovery and stimulate collagen as well. So it's going to help with everything, not just the redness. And you've got your clarifying peels, and there's nothing like a clarifying peel. They're brilliant for taking down acne and breakouts as well. So WOW Fusion or facial is a great place to start. The WOW facial, the other thing about it is you've got your Dermalux light or your little WOW mask, not light thingy. We've got the Dermalux. And don't underestimate the power of the light therapy as well. I've been putting my thumb under it as well. So my other tricks, I had a few things at home. I've not been in the clinic because I can't drive just now. I've got my Mary Poppins bag here. I've got my lovely shoes, which I was going to put on, then I realised I can't put them on with one thumb. I brought a few of my own products that I use at home to treat my rosacea. Was that it? I think that was it. Yeah. No, there should be one more. And I've got the Synergy as well. So this is just a few of my favourites over the years that I've really found and I tend to stick to because they work and I know they work. And then sometimes if a new product comes on, I think, right, okay, we'll try this. And then sometimes it works better, so the old one then gets phased out, as we probably all do. But then sometimes the new product maybe doesn't work as well, so I go back to the ones I know that give me results, okay? And I'll show you a lot of my patients in a few minutes that have used just these products as well. First one, ZO oil control pads. Are any of you here doing ZO skincare at all? The problem is I don't know what the minimum buy is now to start an account with them, but it must be about £3,000 or £4,000 now. It's horrific to try and start an account now.
They've just almost tripled their prices.
Yeah. So they've got really expensive. But if you've got ZO, the oil control pads are incredible for controlling the oil. It does what it says on the tin. It controls the oil. It doesn't just take it down when you use them. It controls it for throughout the day or the night as well. So that's one of my go-tos. I do wish more companies would bring out products to control the oil, but you were saying that, which one was it that you were saying is controlling the oil? Was it the Synergy?
We've got our salicylic wash.
Right. And there was one of the SPFs. I can't remember what one you were saying, but yeah, I do wish more would bring out something like the ZO oil control pads. The next one, we sell buckets of this in my clinic. This is our biggest seller in my clinic. So this is pH formula, which was a complete and utter game changer for me. And Claire's happy for me to talk about other products.
When I first launched WOW, we used pH formula products as one as they're like resurfacing acids as stage 2 for the peel and treat as well. And Pam helped me develop the whole system, and she's now a medical director as well. So we work very, very closely together, and they are fantastic products. Even though I have my own skincare range, I have the odd little bit of pH formula in my skincare range as well. Because it's like Patricia said, you've got to find something that works for you. You've got to find something that works for your business as well. So, you know, when you truly learn about skincare and ingredients and how you hyper personalise, you're never going to find one range. I find it very disappointing when I work into a clinic and they've only got SkinCeuticals, or they've only got ZO, or you know, I want to walk into a clinic and I want to see that they've cherry picked their favourite SkinCeuticals products, they've cherry picked.
And that's what I do.
And I think it's the only way forward. And you can only truly do that when you get education from the suppliers and you truly understand what ingredients do for skin as well. So.
Absolutely, you've got to have good knowledge and know what they're doing. I've got probably 5 skincare ranges in my clinic now. Started off with just one, and then over the years I've just added more because I found that they've all got their hero products. So I mix and match all the time. I think gone are the days where you just stick to one skincare range. So SOS Repair Cream, I mean, this stuff is just amazing. This will repair the skin barrier. It just is, you can't predict how long it's going to take, and it won't do it totally in flushing rosacea patients. That's the one category of patients to really be aware of. Their skin is so unstable. But the repair cream is incredible. I train for pH formula in Scotland, so I'm the Scotland trainer, and so if any of you are interested in taking on the brand, they don't have a minimum buy either. A bit like Claire, which is fantastic for people who are in small clinics, which is most of us. But what I do is when I train people, I'm quite realistic. You know, I tell you about the hero products as well and the hero treatments. So the repair cream, that is going to take you from having that patient having a really unstable skin barrier to having that fleshy, healthy colour. If you've got anything like dermatitis as well, see, I've had people who have got really bad dermatitis in their hands, and oh my goodness, the difference that the repair cream can make to their hands is incredible as well. So it's really good for eczema as well, okay? It's a moisturiser, but it repairs the skin barrier. The other product that is next is the very identical packaging pH formula rescue cream. All my dog walkers use this. Guys who work outside, golfers, people who are runners, hikers. Gary up the mountain. He's in Australia now though. And this is a weather shield, and this will really protect your patients from getting weather beaten. So again, another go-to product. I sell absolutely buckets of these two, and the patients love them because they come back and they want more. And when they come in the door, go, I need more repair cream. It's not just, they don't just wander and say, what's that stuff called? All that, you know, stuff in the red and white. They'll go, I need more repair cream. They love it. It's just
What's the difference between the repair and the rescue then?
So this is it's just the ingredients. This is actually forming like a weather shield, and it's helping moisturise the skin more. This is actually repairing the skin, okay? And then you've got another one of my top tips is advanced nutrition. The advanced nutrition range, the whole range, is fantastic. It's by a company called IIA. They do Environ skincare. Don't know if any of you are doing Environ at all. So
would you use Acumax then for that?
You can do, yeah. You can use. They've got all their protocols in your IIA, Advanced Nutrition Bible. Yeah. So this product here, the Clear Skin Biome, is a fantastic product. It really gets the gut health. It works on the gut health, and it's got zinc in it as well, which Julia was saying was really good for the skin as well. They're skin-specific supplements, so they target the skin. So the skin gets the nutrition first, and then the body, the organs get the remainder of it. Yeah, they're really high quality. They're very, very ethical, and they're very environmentally friendly as well. I love the whole ethos of the whole company. They're fantastic. They're not cheap for people to buy, but they really are brilliant.
Tried everything else in the pot.
Yeah.
A single little product from TikTok or something like that.
Yeah.
You're generally the last person that they're coming to see because the
Yeah.
doctor's not been able to help.
Absolutely. So this, I mean, what you're saying is absolutely right. They'll save money if they start using these really good products. But yeah, absolutely. So the cost of it was not even the cost of a coffee a day. So the advanced nutrition, I just love the range. They power boost your results, and I'll show you that with Gary, who worked up the mountain. I've got also SkinCeuticals. I didn't really need another skincare brand. This was 2021 that I took that on, but it was because Amy, who used to be the rep for IIA, moved to SkinCeuticals, and one day she walked in the door, and she was my favourite rep. Don't know if any of you know Amy Cameron. And she walked in the door and she said, "I'm with SkinCeuticals now, with L'Oreal," and I'm like, oh, for God's sake, as you do when they move company all the time. And so I said, I really don't need another skincare brand. Anyway, I love her so much, and I wanted to give her business because I'm loyal to her, because she's looked after me and supported me over the years. So it works with them as well. And they have got some amazing hero products, but again, they've got a minimum spend. When I started my account, it was 1,500, but it's phenomenal minimum spend. But their products, they've got some brilliant hero products, and for rosacea, this is a wee gem, especially for the flushing rosacea patients, because this one works on the capillaries and it contracts them a wee bit, so it stops them dilating so much. So it's a nice wee gem of a product if you've got SkinCeuticals or access to it. They can buy it online as well. They're not meant to, but they can. This isn't the right picture, but I brought my own one along. This is one of my favourite products, and so many of my patients. I used to have Image, the whole kit and caboodle of Image for years in my clinic. And again, because they had a good rep, funnily enough. And then the rep moved on. And their skincare range for Image dwindled, but they've got some hero products, and this one here, Daily Prevention, it's only a factor 30, but it mops up the oil. My patients love it. It's another one that they'll walk in the door and say, I've got to have that stuff. I don't want to be on holiday without it, or I'm going to run out of it. I don't want to run out. It just feels lovely. It's not oily, and it mops up the oil. SkinCeuticals have got a similar product, this one here, and the only reason I don't sell as much of that is because it's in a much smaller tube, and it's not far off the price of that, and I think that's better value. So but I do stock this one because it's a much lighter feel to it, so some people prefer that.
Spray one, because we use Image as well, and obviously it's factor 50, we'll get rosacea, but
they've brought out a spray.
A lot of rosacea women who stick makeup that they're wearing, but we get them to swap to the mineral makeup. But they have a spray which is great because they're not going to take their makeup off during the day.
Yeah.
Just get them to do a little spray.
Yeah.
It's a factor 30, but it just helps.
Yeah. I should have added into this slide the SkinCeuticals have got the Phytomist spray, but the new Image one, they only brought it out, about 6 months ago, wasn't it? Was it last summer? Maybe, yeah. Can't remember. And yeah, anything that gives them a spray is great. Paul, who is the picture I showed you of the flushing rosacea, he drives a van all day long, so he's getting heat all the time and the sunlight coming in through the window, and he uses a phytomist all the time for helping, you know, keep the skin cooler and help contract the blood vessels. He's still as flushed as anything though. And then any vitamin C product, anything that's going to strengthen the capillaries is good for taking internally. Beware of vitamin C with people who've got an oily skin type. Not everybody can tolerate it, might break them out. I can't cope with vitamin C. I've got my Image vitamin C body lotion on today, but I don't use it on my face. And then another one, it's already been mentioned several times today, niacinamide. Oh, that was the other one that I didn't take out my little Mary Poppins bag here. Vita B3 pH formula. I've got a really lovely couple of products actually with niacinamide. It's brilliant, antioxidant, anti-inflammatory, gives the skin a nice glow, very effective for helping with rosacea. We stopped stocking the daily cream and we just stock the weekly mask now. These masks are gorgeous. I don't know if you've tried them, they're gorgeous. I use the vitamin A one, the retinol mask, quite often. But the vitamin B cream mask, rather, I tell my patients once a week. And the reason I do that is because beware of niacinamide. You can overdo it. People can overdo it. Even though you say to them, don't use it every day, people sometimes do, and it'll break them out more. Well, some people it will. So it can actually go the other way. And again, you don't want to lose that confidence the patient's building with you. So it's about trying to manage all these little things. Niacinamide, always just be a little bit careful with it. It can be quite strong. So that's why I prefer my patients sticking with my little routine of the SOS and my Image and all the other wee things I give them, and using that once a week instead as a mask. And then last but definitely not least, we've got the lovely Synergy 6. Have you all tried it? It's absolutely, it's like a mousse. I love it. It's like a mousse. It comes out like a kind of real, like a mousse type. It's really beautiful and it's so light to apply. Yeah. All right, yeah. I'll pass it round anyway. It's absolutely gorgeous. It's so light. And I love the smell of it as well. Yeah, so that's the Synergy 6, and it's a beautiful product as well. Very high tech. Claire's already talked about it. Really high tech, very good for, in general, if you've got somebody like Samantha who had that phymatous, thick epithelium, you could be giving them that, which is going to help with lines and wrinkles, collagen and elastin stimulation, as well as helping with the rosacea as well. So you could be giving them something that's working away in the background. The other favourite that I've got that's not on here, I've got it on just now, is the Zeo Smart Tone. Again, this is one of our biggest sellers in the clinic. And it's got a very slight tint, takes on the colour of the person's skin. So what you do with this one is you rub it in and it looks this kind of clay colour to start with, and then as you rub it in it takes on the person's skin tone. And again, really nice for disguising a red nose like I get at times as well. So my favourite treatments, Dermalux Light is brilliant. You can use it on pretty much everybody. Well, apart from pregnant women, you probably can, but they won't, you know, they can't test whether you can or not. But yeah, Dermalux Light, great for treating people who are maybe a little bit cagey about trying treatments. It's great just to start them off, get them on a course of Dermalux. Again, it means they're coming in for multiple visits, a course of treatment, so it gives you a chance to connect with them every time they're coming in, check in with their skin care, have a chat with them, make them a coffee, really care for them, really support them, make them feel you know, like they trust you, and build that confidence in your clinic. WOW Fusion, oh, sorry, picked the wrong one there again. WOW Fusion, again, the WOW does everything because it's like a one-stop shop, and doing your it's R2, isn't it, and your age together, doing a bit of this and a bit of that, you're addressing everything. And that's why we did it with Samantha early on, except it wasn't called R2 in these days. Yeah, the Arvit, yeah. That's why I keep wanting to call it Arvit. WOW Facial, again, the peel is brilliant for breakouts. pH Formula has got some amazing resurfacing treatments. The one for redness, which is called the CR treatment, You can do that with microneedling as well. So they're quite similar, you know, in what you can do with them. But I have to say, the WOW, you really do see the difference when you've been doing them on somebody. Zeo have just brought out the restorative peel about a year ago. Thank goodness, because God, their peels are so boring. But we hardly do it now because the WOW and the pH have taken over, but it is there, it's available. I do IPL in the clinic. I have done the whole time I've had the clinic. I bought myself a machine, just about went bankrupt to buy it, but I was setting up a clinic, so I thought, oh, what the heck. So, and it's a workhorse. It's brilliant for taking down these broken veins and helping generally take down the redness even more. It is a bit of a game changer, but you know, it does cost an arm and a leg. I've recently bought the Age Jet, which it only came out the year before last, and I bought it in April last year. It's virtually all we're doing in the clinic just now. It treats everything. Again, another one-stop shop. Not quite as expensive as the IPL, but it's nitrogen plasma and it regenerates the dermis of the skin. It's like the Neogen, isn't it? It's the same sort of idea. So it's good for pigmentation, redness, anti-aging, the whole lot. And for somebody who's got that real rhinophyma, the thickened nose, or the phyma on their skin, if they want quick results and they can't be bothered waiting for months and months and months for the results, send them to somebody, usually in Glasgow, who's got the CO2 laser. I have to say though, my patients very rarely want to go through that. My patients, the sort of people who don't want the whole world to know they've had treatment. Of course, if you send them for a CO2, they're going to have a very scabby face for a couple of weeks and not be able to go out. So the CO2 laser isn't for everybody, but for somebody who maybe has that very reptilian neck or, you know, a lot of aging, phyma, it's the one-stop shop really, but they will have a lot of downtime with it. I'll quickly run through a few of my cases. This was Denny, who I showed you earlier. I showed you the slide of her round her nose. This was her forehead, and you can see she had the telltale signs. This is often a wee sign of rosacea, is a little bit of redness here. This, believe it or not, was 3 weeks later on the pH formula repair cream and the SPF. And this is what she got just with the skincare. Look at the difference in the consistency of the colour and the skin tone. It's consistent now, and it just looks better. And that she went from that to that. So the breakouts have healed up and her skin very quickly responded. That's her other picture before and after. Again, 3 weeks it took for her, and she's in her 50s, so that's quite incredible time that it took to get that result. But look at the redness around her nose, gone. Didn't even need to use the IPL. Redness on the chin, pretty much gone, and the forehead was gone. So that's Denny. I didn't use IPL on her, I only gave her the skincare. Only gave her the skincare, and it took down the inflammation. This was Billy, started him in the first COVID, and this was a year between these pictures. If you're posting your pictures online, that's another wee tip. For goodness sake, put how long that took to get that result. Because people will see it and they'll come in and go, I want that result, and they'll expect it next week. You know what people are like, you know, so you've got to be realistic. Be realistic on it, even your social media. Be honest, because you're only going to save yourself a whole lot of hassle later on. So Billy had suffered for years with, he had a big nose. And he confessed that himself, you know, it's like, I've got a big nose, I've got a big hooter, you know. And so constant breakouts and a bit of redness on his chin. And yeah, you can see the difference. I did IPL to take down these big broken veins that he had after I got his skin sorted out with the skincare. But I got him on the skincare for 7 months it took to repair his skin barrier with these creams and a bit of niacinamide. The niacinamide really helped him actually. And then I did a few WOWs, and then I did IPL to take down these big broken veins, and that was him. And he maintains that now with great pride. And he was the guy that when his wife dragged him in, he went, what, 50 quid for that? You know, for one tube. He is now a total product junkie. He just loves his skincare, and he spends far more than his wife does as well. And he then after that went and got his teeth fixed. Then I did the hair wow for him. Yeah, I could show you these pictures as well. And then Lindsay, 2 years between these pictures. And look, she still gets breakouts. The oiliest skin I have ever treated. She's a fellow dentist. Her face is like an oil slick. And oh my goodness, trial and error. It took a lot of determination from both of us to get her to that stage from that. She'd been treated for years for acne, by everybody for acne. But again, when she came in, she had that wee telltale bit of redness, which you can see a little touch of in that side picture, round her nose. So that was my little, signal to me, let's try rosacea treatment. And her skin is beautifully clear now, apart from the odd wee breakout that she'll get. But usually she'll know what's caused it. She'll have her triggers. Absolutely. They always look happier and younger. Although she does look like she's 12 years old all the time anyway, and she's in her 40s. And then the last one is Gary, who I show with great pride. Because he was away for a month at a time, he was just about to go away when he first came in for his consultation. Again, his wife, who'd been a dental patient of mine for 30 years, nearly dragged him in. And so, yeah, it was a case of, we're not going to get you back in for treatments, let's give you the skincare. And he would take it away, set it up on he would send me pictures of it all set up on his little chest of drawers in his little room, up the gold mine. And we also gave him the advanced nutrition. And I believe that that's why we got that result in 4 months, 4 months from that to that. And we are convinced that was the advanced nutrition power boosting the results, the gut element of it. So he had no treatments at all because it was just difficult for him to get in for treatments. And look at the lines. I mean, I often show people this and say, look, you don't actually need, sorry, I keep hitting the wrong button there. And that's with my good thumb. So, yeah, look at the lines. There's no Botox or filler used at all. But look at the lines. Look at that, unfortunately, my name, but look at the difference in his skin. Yeah, so there you are. So that's the end.